answering your questions about medicine and health issues. This is Health Break with St. Francis Emory Healthcare.
Hey y'all, and welcome in. We're at St. Francis Emory Healthcare, and today we're talking about neurosurgery. Dr. Adumi, when we hear neurosurgery, most of the time we think just brain, but what is the full scope of everything that you treat?
The full scope does include the brain, obviously, but a bigger part of it, especially with public health, is actually the spine. The simpler way to put that is you're going to have more people that have back pain than have brain tumors. So coincidentally, a lot of what we end up taking care of involves the spine, neck pain, lower back pain, things of that nature.
Let's talk about some of the symptoms. What could people be experiencing that would prompt them to make an appointment with a neurosurgeon?
The most important thing, or the most concerning one, is weakness. Weakness in the arms, weakness in the legs. Once it gets to that point, we tend to move a little faster with surgery. Prior to weakness, one thing that people who experience is pain. Pain in the back, pain traveling down the arm, pain traveling down the legs. Pain is not as urgent, but what does become concerning is when weakness becomes a factor.
Now, if someone does have the diagnosis of a brain or spinal tumor, what are some of the treatment options before we hop to surgery?
Yeah, that's a big one, but there are a lot of options. A lot of it comes under hematology oncology with different chemotherapy options, then radiation oncology with radiation options. Surgery is often, or most often, a last resort. But we also work hand in hand with the oncologist as well to make sure the most appropriate standards are being met as far as therapy.
And if someone does go through that surgery, what does recovery look like, and what are some of those steps that are taken?
You know, it's varied. Are we talking about brain surgery or
Yes.
spine surgery?
Or a little bit of both.
A little bit of both. Spine surgery, as you can imagine, depending on how extensive the surgery is, recovery can be quicker. With brain surgery, recovery can take a little bit longer, not necessarily because of pain, but mostly more because of cognitive limitations and such. And it just takes a little while for the body to get back to 100%. With brain surgery, you're not so much removing pain, you're trying to preserve cognition and long-term function, which ironically ends up taking a longer time to recover from.
All right, great information, and we know that we can get the help we need at St. Francis Emory Healthcare. Thank you so much.
Thank you.
And we'll see you all on the next Health Break.